Hey, hello lovely people. Welcome back to my YouTube channel. This is Glory on Kirea once again. And in today's video, we are going to talk about emergency contraceptives. If you're new here, please consider subscribing to this YouTube channel. And if you've already subscribed, thank you for always coming back. Thank you for always watching my videos. Please do watch this video to the end so that you can understand everything about emergency contraceptives. So today I want us to understand the methods that can be used as emergency contraceptives, because there are a lot of them, there are many, but I know most of us know about one method, that is the emergency pill, or the P2, or the emergency pill, or the morning after pill, whatever you call them. But I know this is the most common and the most used. But in this video, we are going to learn about many more methods that can be used as an emergency method. So the methods that I'm about to share with you today are called emergency contraceptives, because they are used in emergency situations whereby you end or have unprotected sex and you're not ready to get pregnant or to conceive. So these methods can be used to protect you against against pregnancy immediately after having the unprotected sex. So I will start by sharing with you the most common, that is the E-pill, or the morning after pill, or the Plan B pill. And this pill is a pill that contains one hormone, that is levonorgestrone hormone, and they work within 72 hours for most effectiveness. If you want them to work very effectively, you have to take them within 72 hours, or rather take them immediately after the unprotected sex. These pills works by delaying the release of an egg, or inhibiting the ovary from releasing an egg which is fertilized by the sperm. It also works by thickening the cervical mucus, which prevents the sperms from swimming faster to fertilize the egg. So it just works like any other hormonal contraceptives, which I have a video on each of them. So if you want to understand these hormonal contraceptives, any of them, just watch my previous videos and you understand all of them. So these emergency pills works just like any other hormonal contraceptive. For maximum effectiveness, you should use them or take them immediately after unprotected sex, or rather, if you delay, just take them within 72 hours of unprotected sex. They can also work up to 5 days maximum, but the more the days go on, the less effective they become. So for your safety, just take them immediately or within 72 hours of unprotected sex. So they are very effective, but as we all know that there is nothing that is 100% effective. So that means that there are some women who will take this morning after pill and still conceive. But it also depends with a lot of things, with many factors. If you take this pill later than 72 hours, the effectiveness reduces. The other things that determines or affects the effectiveness of this pill is the weight. So the obese people, the people that have a higher BMI, they should take a higher dose, or rather don't take higher dose without consulting your doctor. So you need to consult your doctor if your BMI is high, so that you can be told, or you can be prescribed a higher dose that fits your weight. Because if you're obese and you take just the regular dosage, then the effectiveness of this morning after pill reduces. The other factor is vomiting. If you vomit within 2 hours of taking this morning after pill, then that might reduce or even completely fail the working of these contraceptives. So if you vomit 2 hours after taking this emergency pill, please do repeat the dosage, take another dose just like the one you end before vomiting. The other thing that is that will affect the effectiveness of this morning after pill is the disobedience to the instructions. Some manufacturers make them as 1 dose, the other one makes them as 2 doses. So if you get the 1 dose and you're told to take 1 dose, please just follow the instructions. Just take 1 dose, and that will be enough to protect you from the unprotected sex. And the other one comes with 2 tablets. That is, you're told to take 1 pill immediately, and then after 12 hours you take another pill. That will protect you effectively. But if you do not follow the instructions, then be sure to have reduced the effectiveness of these morning after pill. The other thing is, if you're already pregnant, so if you're already pregnant, there is no reason for you taking this medication or this morning after pill. If you're already pregnant, it will not affect the existing pregnancy, but it will also not work as an abortion medicine. So if you're already pregnant, it will not work. It will just not work. So that means before taking this medication or this pill, you must be sure that you're not pregnant. You must have tested or maybe calculated your days. So just like any other hormonal contraceptive, these emergency pills or the morning after pills has their own side effect. And number one side effect is the interference with the menstrual cycle. If you take these morning after pills before your menstrual period, let's say you end unprotected sex today and your menstrual period was like 2 weeks away or 1 week away, then you will expect changes in your menstrual period. So it might get delayed for some few days or some few weeks before you get your monthly period. You might have a slight spotting or bleeding. You might also have irregular menstrual cycle. That is, if you end a very regular menstrual cycle, after taking these pills, your menstrual cycle might be irregular, but this will not last you for long. It will just last for maybe 3 months, and then your cycle comes or returns back to the normal. The other side effects are very common, and these include things like nausea. You might experience nausea, but if it is very severe, you can have some nauseic pills to reduce the nausea. You can also vomit. You can also experience vomiting. So if you vomit, as I earlier said, if you vomit 2 hours after taking the morning after pill, please do repeat the dosage. But this is one of the side effects. So if you vomit, just repeat the dose. Morning after pills are very safe to all women. So they can be used under many circumstances, and that is what I want us to understand. When can you use, or when are you supposed to use this morning after pill? Number one situation is rape. If you are raped, that means that you end unprotected sex with a known person without your consent. It means that you are a candidate for this morning after pill. You should take them to protect yourself from getting pregnant or conceiving from this unknown person. The other thing is about misuse of contraceptive pills, that is the COCs or the POPs. If you realize that you've missed these pills maybe 3 times, 3 days, you should take the emergency pill to protect you from getting the pregnancy. The other situation is when you're using barrier method like the condom. So if you're using a condom and then it bursts or it slips off, or you suspect that you've used it in the wrong way, so you are also a candidate of using this morning after pill. Also, some people that use the withdrawal method as a way of family planning, and it is very effective to them. So if you use that withdrawal method and you do not withdraw at the right time, or withdraw in the right way, or maybe you delayed or something like that happened, and you suspect that you did not do it the right way, so you become a candidate of taking these emergency pills if you do not want to conceive. The other candidate of this emergency pill is people that use Depo-Provera or the 3 months injection. If you delay for 7 to 2 weeks, 7 to 14 days without getting the next injection, you become a candidate of this emergency pill to protect you maximally from getting pregnant. The other people that can use this contraceptive is if you are using the IUCD or the copper T, or let me call them the IUDs, the intrauterine devices. There is hormonal and there is non-hormonal. So if you're using one of them and it slips off or it comes off, or maybe you suspect that it is not in place, you become a candidate of using these emergency pills. The other thing about these emergency pills is that they do not protect against STIs, that is the sexually transmitted infections, including HIV. The other thing is that they do not interfere with an existing pregnancy. So that means that if you're pregnant already and you didn't know and you take these emergency pills, they will not affect your pregnancy and even your unborn baby. They do not cause defects or birth defects to the unborn baby. So the other methods that are used for emergency contraception is the IUD, and these are the intrauterine devices. There is hormonal and there is non-hormonal. So these are the very, very effective methods of family planning which can be used as emergency methods. So if you use copper T or the hormonal one as an emergency contraceptive, this will be very, very effective, and this can last you or can protect you against pregnancy for 5 good days, not like the other contraceptive, that is the pill, that might reduce the effectiveness after 3 days. This one is protect you against pregnancy for 5 good days. I have a video explaining everything about the IUDs. Please do watch it and understand everything you need to know about IUDs. The other thing that can be used as an emergency method is the common pills, the 21-day pills, the COCs, that is the combined oral contraceptives. These are the Femiplan, yeah. So this can be used also as an emergency pills, and you can take them on a higher dose. That is, if you end unprotected sex and you don't have an access to the e-pill or the IUD, you can use these COCs. And the way to use them is that you use them on a higher dose. That is, you can take 4 tablets at once, and then after 12 hours, you can take another 4 tablets. And if you do that, you will be sure to be protected and will not conceive if you had not planned to do that. So I think that is all I had for you today about emergency contraceptives. If you've not already subscribed, please do not leave until you subscribed. And thank you for watching this video to the end. I love you guys, and bye bye.